Welcome to USMLE World, where we ask, answer, and explain USMLE questions. Today, we're diving into Step 2, Internal Medicine, Renal. Let's get started with question number 1. For the following case, which of the following changes would most likely be present on this patient's renal biopsy? A. Diffuse capillary wall thickening on light microscopy. B. Discrete subepithelial humps on electron microscopy. C. Glomerular basement membrane fibrin deposition on electron microscopy. D. Glomerular basement membrane splitting on light microscopy. E. Linear IgG and C3 deposits on immunofluorescent microscopy. The case scenario is: a 5-year-old girl is brought to the clinic due to 2 days of dark red urine. The patient was treated for facial impetigo 1 month ago. Blood pressure is 140/90. Urinalysis reveals hematuria, mild proteinuria, and occasional red blood cell casts. The question is, which of the following changes would most likely be present on this patient's renal biopsy? Your options are: A. Diffuse capillary wall thickening on light microscopy. B. Discrete subepithelial humps on electron microscopy. C. Glomerular basement membrane fibrin deposition on electron microscopy. D. Glomerular basement membrane splitting on light microscopy. E. Linear IgG and C3 deposits on immunofluorescent microscopy. You have 15 seconds to type your answer in the comment box. Congratulations if your answer is B, which is discrete subepithelial humps on electron microscopy. This question is designed with the focus to assess your ability to conduct laboratory or diagnostic studies. This patient has nephritic syndrome, characterized by hypertension, mild proteinuria, and hematuria with red blood cell casts in the urine sediment. In association with a recent skin infection, this presentation suggests post-streptococcal glomerulonephritis, the most common cause of nephritic syndrome in children. Post-streptococcal glomerulonephritis is an immune complex-mediated disease that occurs 2 to 4 weeks after exposure to group A beta hemolytic streptococcus, example, pharyngitis, skin infection. Antigens expressed on nephritogenic streptococcal species combine with antibodies to form immune complexes, which are later deposited on the glomerular basement membrane. On light microscopy, all glomeruli are enlarged and hypercellular due to leukocyte infiltration and proliferation of endothelial and mesangial cells. On electron microscopy, electron-dense deposits, humps, on the epithelial side of the glomerular basement membrane are seen. Immunofluorescence reveals coarse, granular deposits of IgG and C3 that have a characteristic lumpy-bumpy appearance. If you choose any option other than B, you are wrong. Let's briefly discuss the other options. A. Diffuse capillary wall thickening on light microscopy. Uniform, diffuse thickening of glomerular capillary walls on light microscopy is characteristic of membranous glomerulopathy, one of the most common causes of nephrotic syndrome in adults. Manifestations of nephrotic syndrome include generalized edema, marked proteinuria, greater than 3.5 gram per day, hypoalbuminemia, hyperlipidemia, and lipiduria, C and E. Glomerular basement membrane fibrin deposition on electron microscopy and linear IgG and C3 deposits on immunofluorescent microscopy. In contrast to post-streptococcal glomerulonephritis, which demonstrates granular deposits of IgG and C3 along the glomerular basement membrane, linear IgG and C3 deposits on immunofluorescence microscopy are characteristic of Goodpasture syndrome, anti-GBM disease. This commonly presents with rapidly progressive, crescentic glomerulonephritis. Damage to the glomerular basement membrane results in leakage of plasma proteins and heavy fibrin deposition in the glomerulus, resulting in parietal cell proliferation and crescent formation. This disease is uncommon in children, and renal involvement is often accompanied by pulmonary symptoms, example hemoptysis. D. Glomerular basement membrane splitting on light microscopy. Glomerular basement membrane splitting is seen in membranoproliferative glomerulonephritis and Alport syndrome. Alport syndrome causes nephritic syndrome but is most commonly X-linked and therefore more common in males. It is not associated with recent streptococcal infections. Membranoproliferative glomerulonephritis causes nephrotic syndrome. Your take-home message from this question is that post-streptococcal glomerulonephritis is an immune complex deposition disease that occurs 2 to 4 weeks after exposure to group A beta hemolytic streptococcus species, example pharyngitis, and skin infection. Light microscopy shows enlarged, hypercellular glomeruli. Immunofluorescence demonstrates a lumpy-bumpy, granular deposits of IgG and C3 on the glomerular basement membrane, and subepithelial, electron-dense deposits are seen on electron microscopy. Did you get the answer? Proceed to the next question by clicking above only if you've got the answer right. However, should you fail to answer correctly, it is imperative that you watch this episode again. Remember, understanding is key to progress. Unlock the secret to acing your medical exams, especially the USMLE, with our top-notch resources. Ensure you and your friends are well prepared by hitting that like button, sharing this wealth of knowledge, and subscribing to our channel. Remember, your success is just a click away.